Okay, guys, hi, how are you doing? Back on our premenopause topic as we go ahead and finish. Question is still, how is premenopause diagnosed? No lab test will tell you this is premenopause. Your signs and symptoms that you present to the doctor and your age is going to determine that you are premenopause. So there's no test per se. You'll have some people say, oh, have your lab work drawn on this day and this day. But really, some providers will just go by your signs and symptoms and your age, and basically that's what you need to tell you that you are in premenopause. Again, from the previous video, starts anywhere. Unfortunately, there are people who start in their late 30s, but for most people, it's anywhere between 40 and 50, 55 for some who are late, but pretty much between 40 and 50. That is when those symptoms begin. And I won't go over the symptoms. You'll check out the other video. If you need to know what are the symptoms, my topic today is to treat or not to treat. Again, my name is June. I'm a nurse practitioner, but I am not your nurse practitioner. So that's an individual answer that you come to yourself between you and your provider when you discuss, what are you feeling? Do you want to try the treatment? Some people will tell you, no, I don't want to try the treatment. I just want to see if stuff that I can do, if I can change my diet, if I can do natural stuff and it will help me, then I can go that route. And that's okay. Because it's, as I said, it's a shared decision making between you and whoever you see as your primary care doctor, or whoever you're seeing for this menopause journey of yours. Are you seeing it from a regular doctor? Are you seeing it from an OBGYN, nurse practitioner? Whoever you're seeing it with, the agreement is between you two, and more likely they will lie with what you, the patient, wants to try. So there are people who will go the healthy route and want to try exercise, diet, and supplements that are natural, and that's okay. Because you are the patient, whatever suits you is what you go by. And then there are some people who will try and say, oh no, I cannot handle the symptoms. These symptoms are just too much for me. I need help with them. In those people, there are cases where they will start you on what we call hormone replacement therapy, and that's the HRT that most people talk about. So you will go over options with your provider, whoever your provider is, and they can go over what kind of hormones they have. You do have oral intake hormones, and you do have patches, you have cream. There are lots of options. So whatever is the choice between you and the provider you are seeing, eventually it falls back to you. What would you like to try? After they've explained to you the signs and symptoms and side effects of the medication. Mainly, what are the side effects of the medication or the hormone replacement therapy you're going to get on? You as the patient, are you willing to try all that? Knowing it's something that's coming in you. So you may have a side effect. Doesn't mean everybody who's on a medication does get a side effect, but you can't discount the side effects of the medication. You need to know what they are, and are you willing to take the risk to feel better but be on the medication while knowing that you're at risk of something, whatever the side effect is for whatever the medication is that you have tried. So that's something you sit down with your provider, go through them. Do you want hormone replacement therapy, or do you want just a medication that reduces the symptoms, so that in this case it can be antidepressant to stabilize moods for those who are mainly affected with moods? Do you want the antidepressant to see if it will treat the mood, and then you try that and that works for you, and you're like, you know what, I don't need to be on the hormones, and that's okay. Whatever choice you make is okay, because you're the patient, you know what you're trying, you know what you're asking help for, and if they give you these decisions, the decision is definitely up to you. What do you want on it? Some healthcare providers will just suggest, as I said, lifestyle changes. What about trying exercise? The exercise will make you feel better if you have the energy to go exercise. Do you want to try exercise? Change your meals and see, is this working better for me? If I eat more healthy, is it helping me sleep? Am I feeling better after I exercise? And whatever exercise is to you. Are you walking outside in the park? Are you exercising in a gym? Are you stretching? Are you doing yoga? Whatever exercise is for you, is it making you feel better? If it's making you feel better, that's a modality you can go by. You can use that and see, is it going to push you through the symptoms? And if it does, perfect. That's a good way to go. You can just know that when the days I exercise, I feel better. The days I eat right, I feel better. So then you decide to go with that. Exercise regularly. Eat at least 1,000 to 1,300 of 1,200 of calcium each day through your diet or supplements. Most people will say, oh, I'm not able to get it through my diet. So then it's okay to supplement at that point. So you can do that. Increase your fruits and vegetables, whole grains. That's the change in diet we're talking about. So you're more likely going to a healthier part, not fast food. Healthier, preferably cooked at home. You can still get healthy food in the restaurants, but healthier food, and see, is it making you feel better? Are your symptoms improving? So that's another way you can go. Another way, you can do a diary and see what worsens your symptoms. When I eat this, my symptoms worsen. Or when I don't exercise, I feel more lethargy, I feel more brain fog, I feel more tired, or I sleep and I'm not rested. So keeping a diary will make you know that the implementation of what you're doing, what's working and what's not working. So discuss these other treatments and relieving symptoms with your provider. Some people will try supplements, as I said, like natural supplements, which you have them in the shops. You just have to find out which shops carry them. You have natural grocers, you have Whole Foods. All those places do have natural stuff that you can use that are supplements, and pretty much it's plants that have been used before, that people swear by or have reported good results with. So you can use that. See, is it working for you? Is it not working for you? Some people have been successful on it, and if you're successful on it and you don't have to go on medication, that works for you too. So the key points again about premenopause is the time around menopause, time around menopause, when your ovaries gradually stop working. It's a natural process that causes physical and emotional signs, and you, the patient, experience those symptoms. No, you're not crazy. You are actually experiencing them. If you do get somebody who tells you it's in your head, change providers. There's so many people who can see you and listen to you and acknowledge what it is you're going through. If somebody says it's in the brain, it's what you're experiencing, change providers. There are too many providers to be accused of something like that. It does not need treatment. Some people can get through it without treatment, but some people, the symptoms are kind of disheartening to where they need help with treatment. And both choices are okay. If you need treatment, if you don't need treatment, all your symptoms are valid. So you as the patient, what you want is what we go by, but all symptoms are valid. If you decide I'm having symptoms and I'm not going to do anything, that's perfectly fine. And as I said, there are those patients that will have symptoms and it's too much for them to handle. It's okay for them to seek help. Absolutely okay. No need to suffer through the symptoms. It's a long period of time, so I don't know that you can suffer for 7 to 10 years. If you need help, go for it. If your natural substances are working, go for it. Whatever rocks your boat. Treatment includes hormones, as I said, hormone replacement therapy. That's the big one. Okay. So key points about perimenopause. It's the time around menopause, pre-menopause, just before menopause. So it's the time around menopause when your ovaries gradually stop working. So it's a natural process, causes physical symptoms and emotional symptoms in most people. So remember that. Say your symptoms to whoever it is you're seeing. If it's a OBGYN, nurse practitioner, physician assistant, whoever you're seeing, tell them what your symptoms are. Do not let somebody tell you it's in your head. If they tell you it's in your head, change providers. There are so many providers, and there are providers that will understand what you're going through. So if you get one who thinks it's in your head, change providers. You don't need that kind of judgment with that kind of change in your life. No, absolutely not. It does not need treatment, but some symptoms will lessen with treatment. So whatever your choice is, do you need treatment? Maybe. If you don't need treatment, are the natural things you're doing helping you? If they're helping you, absolutely. keep with them. Not everybody needs treatment. There are those who their symptoms are just extreme, and for some reason they have to be on treatment. You, if your symptoms are working on natural stuff and you're happy and it's controlling them for you, absolutely, you don't need to have oral treatment. As I said, the treatment includes hormones, antidepressants, and lifestyle changes. Those are the main three: hormones, antidepressants, and lifestyle changes. So the people who go for exercise and the food changes cause the symptoms to decrease, more power to you. That works for some, but doesn't work for others. So those are your three options. Choose whichever works for you and whatever you decide between you and the provider that you're seeing. So that's basically premenopause. It's a long journey. You need to be comfortable in it. It is anywhere from 7 to 10 years. So if you're getting the extreme discomfort, extreme symptoms, you're just fatigued like crazy, seek help. Whatever help is for you. Is it taking the hormones? Is it the lifestyle changes? Or is it the natural products that somebody has told you they work, that are not oral intake? It's just plant substances that have been used before and work for you. If that's for you, then that's okay. Anything to help the symptoms ease, because it's a long period of life to be miserable. And your life doesn't end at premenopause, menopause. So you don't need to be miserable. Take care of yourself, change your diet, exercise as much as is possible with your schedule. If you're going to see a provider and you tend to forget what to ask, write the questions down before you go. Take somebody with you so that they can remember what to ask if you do forget what to ask. Know the reason for your visit before you go. Know the reason for your visit. Does your provider, if you want hormones, is your provider a hormone-friendly provider? Are they listed on the Menopause Society providers? That's what you need to know, because some people are against hormone therapy. So if you're going to somebody who's against hormone therapy and they're not on the list, you don't need to be going to see that one. You need to see one who's covered by your insurance and is on the Menopause Society list. Write down what you're told during the visit. That way you don't forget. I mean, you can always call back, but it's important that you write it down so you don't have to call back and remember, what did they tell me? And if you had somebody, at least you can run it off each other. Know the medicines, know everything, and ask questions. Ask questions. Absolutely ask questions. And yeah, ask questions as you go for this visit of yours. Write them down and write what you're told down. Clarify before you leave the office. Clarify and find out, is this what you mean? And does this mean this? What is this diagnosis? It's okay to ask questions. It's okay to ask questions. If you start on a medication, know what the medication is, know what the side effects are, know when your follow-up is. So that way then you can ask, how is it going to help me? I'm taking this medication. What do I expect? And within what time do I expect this? So ask those questions. Don't be intimidated. Make sure you write them down. Ask them so that when you're there, the doctor can tell you, and ask them, is there another way I can treat this? Do your research. Sometimes it's easier to do your research before you go than to remember after you've gone for the visit. So do your research before you go to the appointment. That way you have your questions in place and you can ask and they can tell you the answers before you leave. So it's good to do research prior to. Ask the doctor the medication, the side effects. Is there an alternative to this medication? What are the ones you offer in this group that have less side effects? Or what are your thinking on this? It's okay to ask questions because ultimately you, the patient, make the decision. If you have a follow-up appointment, write the date down so that you follow up. Write questions down. If you forgot to ask them in that first visit, write them down so that on your follow-up appointment, you can follow up and have that asked and be answered before you leave the question. Know who to contact from that office if you leave and you have questions. And this is an absolute burning question that you have that you didn't ask. Maybe call the office and ask them if you have a question. Most offices have what we call a patient portal. And if they have time, you can write. It's not an immediate one, You write a question, wait a few days, and somebody can reply to you. Other offices do not have a patient portal, so you may not have anybody to ask this question. So it's important that you do your research before you go, so you have it written down and you can ask somebody, or alternatively, then call and find out if they can return a call. They're usually pretty busy, so that's not a good option. But if you have a patient portal, then they can, you can write an email and somebody can get back to you, whoever it is for you. So that's in a nutshell premenopause. Then we'll be heading into menopause. You guys have a great weekend. Take care. Bye bye.